Hi guys, welcome to my channel and learning together. So today we will see the part 2 of central line care series. So previously we have seen part 1 about different types of central line care. Then what are the articles needed for central line care insertion? What is the technique used for central line? Most common technique that is used for central line insertion. Then what are the different complications of central line. So today we will see the part 2 of this central line care series. So before that, if you do like this video, please hit the subscribe button and also press the bell icon for quick notifications. So let's begin. So coming to part 2. So coming to the articles which are needed for central line care. So central line care is an essential part of the nursing aspect. So because it helps to prevent infections, okay, and also helps to as we have seen in the previous slides about the different complications, skin erosion, then air embolism. So everything is a part of the central line care. So central line care should be done properly to prevent those complications. So for central line care, we need two trays, that is sterile tray, another one is the clean tray. So in sterile tray, we should have sterile gauze, bowl with sterile spirit swabs, sterile towel. And in clean tray, clean gloves, sterile gloves, 70% alcohol spirit, alcohol swabs, then Tegaderm, kidney tray, 10 ml saline flush, tri-way ports, mask and labels. So coming to the procedure, first you have to collect all the articles for care, explain the procedure to the patient if the patient's GCS is good. Then wash hands and put the mask, don the clean gloves and remove the previous dressing. Okay, while removing the previous dressing, you need to look the insertion site for any redness, edema, okay, any pain to the patient. Okay, all these things has to be checked while removing the dressing, and while removing the dressing you should be careful and also look that whether the suturing securement of this CVC is done properly or not, otherwise it can get dislodged. So while removing the previous dressing you should be careful enough. Then assess the site, remove the clean gloves and perform hand hygiene, then open the sterile dressing set. Then pour chlorhexidine or 70% alcohol into the sterile bowl. Don the sterile gloves. Clean the site with chlorhexidine in a circular motion. So chlorhexidine swabs are, if it is available, then you have to clean the insertion site in a circular motion. Clean the site for 30 seconds with 2% chlorhexidine. And also the lines which are there with 70% alcohol swab for about okay, the alcohol, with the alcohol swab you have to clean the lines as well, and also the hub. Okay, the hub is the part where most of the medications, blood, TP and everything is given, so that part should be cleaned properly as well. So clean the hub for 15 minimum of 15 seconds or 30 seconds maximum in both clockwise and anti-clockwise direction before and after, while central line care as well, and also while giving medications through those hubs you have to clean the hub properly. After that, let the alcohol dry and then apply Tegaderm, securing the line without any air trap. We don't want any air to be trapped in the dressing because it can enter into the central line and it can cause air embolism. Then scrub the injection hub, clean caps with 70% alcohol as well. Okay, also the caps which are there, you can replace the caps, or the existing caps which are there, you can clean it with 70% alcohol. Then check the backflow and flush the line with saline. Okay, so that you would be able to know whether the CVC has got dislodged or any clot is there or not. So you have to check the backflow of blood and flush the line after that with saline. Then wrap a sterile pad around the ports. Okay, so that it does not get means dislodged, or it while giving morning care it does not get pulled away. So you have to check all this. Then label with date and time in both sterile pad and dressing site. So both the dressing site as well as sterile pad, you have to label all the date and time when the dressing was changed. Replace the articles before hand hygiene, and then after that perform hand hygiene, and then record in the nurse's notes for any abnormal findings in the this central line dressing. Okay, so these are all the steps that you need to follow while doing the central line care. So coming to the dressing, so you can see this is the tegaderm. There's a transparent dressing which is put. So this transparent dressing, if it is not soiled, then you can change it in every 5 to 7 days or whenever it is soiled. Okay, so whenever you see that soiling is there, so you should immediately change the dressing. And here you can see the labeling. Here you have to write what is the date of insertion of the catheter and when the dressing was changed. Then next, suppose any soakage is there in the central line dressing site. Sometimes what happens, the after the insertion of the central line, there is some soakage is present. So gauge piece dressing can be done. So a gauge piece can be kept while doing the central line care, and over that the tegaderm dressing is placed. So if there is some soakage or any secretions are there, so the gauge piece should be placed, and in every 2 days you should change the gauge dressing. Otherwise, if there is no soakage, no need to put the gauge dressing. So because if you will not be able to see the insertion site for any redness or edema. Okay, so if no soakage is there, no need to place. Otherwise you can place it, and you have to change it in every 2 days. Or if you are seeing that soiling is there, then you can change it within 1 day also. Then these are some of the different techniques of securing the central line site. So you can see here, this is one method. So where this central line, this wings which are there, so it is sutured to the skin, and over that a tegaderm is placed. Then the second method, you can see the insertion site is means it is dressing is done separately, and the wings which are there in the securement device which is there, it is the dressing is done again separately for that. So both dressing are done separately. Here also you can see this is another method of dressing of this site. Then this is adhesive liquid is used to stick this insertion site and this securement device to the skin. So this sometimes can cause skin erosion. So always use a skin barrier solution before using the securement device, and look for the skin peeling or anything if it is there. So while central line care, you should look for that. So mostly we use these three methods. This is not much used. Then coming to CVP line flushing. To ensure, why we need to flush? To ensure patency. As I have already told in the previous video that we always use a 10 ml syringe while flushing the catheter. So that because here in 10 ml syringe there is decreased pressure and catheter damages are minimal. And in case of you can also use 20 ml syringe for flushing as well. Then blood sample and after giving medication, flushing to be done. It is very important, because if you take blood samples and if you don't flush, or suppose any blood transfusion is going on through the line and after that you forget to flush it, so what will happen, the blood which is there in the line, it will get clotted, and the central line will get damaged. So if the lumen is not used, then every 24 hours the lumen must be flushed separately. All lumens must be flushed separately. And while taking blood sample or medicine, you should flush after giving any blood or medicine. Flushing should be done with either 10 ml or 20 ml. Minimum 10 ml syringe should be used. And also in TPN or blood sample, you should use a 20 ml syringe because more volume of flush is needed to flush all this, because they are viscous liquids. Okay, blood, TPN, these are viscous liquids, so more amount of flush might be needed for flushing. Otherwise, for any other medications, you can use 10 ml syringe. And while flushing, you should use start and stop method or pulsatile mechanism, okay, so that any clots or any blood in the line can be swiftly, it can move through the line and it can enter into the blood circulation, okay, so that no blood is present in the line, otherwise there is chances of infection can be there. So start and stop method or pulsatile mechanism can be used so that it will create a turbulence and it will break the clot if anything is present on the line. So flush the line with 20 ml syringe if viscous liquids, as I've told, if any blood sample administration or TPN or contrast media is used, you can use the 20 ml syringe. Then close clamps when it is not in use, and replace the tubing after every 24 hours of drug, blood or TPN administration. So after every 24 hours you have to replace all the IV sets, the fluids bottles, the blood lines, then the TPN lines, everything. And if propofol infusion is going through the line, then in every 6 hours it should be changed. Means the syringe, the infusion syringe, the PMO line, everything should be changed, and the line should be flushed with 20 ml, because propofol is also a viscous liquid, it has lipid emulsion in it, so it should be flushed after every 6 hours. If three-way ports or caps of CVC are soiled with blood, change it. Okay, don't keep, because whenever any blood is present in the three-way ports or inside the lumen of the tubes, so it becomes a medium for the microorganisms to grow, and it can cause further infection, that is CLABSI, central line associated bloodstream infections can be there. So you should always look for any kind of blood soiling of blood in the sports or in the dressing. Okay, whenever you see it, you should always change the dressing or the ports, whichever is present. Then coming to the next, that is blood sampling techniques. So there are two methods of blood sampling technique. One is the discard method, another one is the push-pull method. Any method you can use. So coming to the discard method, in the discard method what is done, here the catheter hub which is there, it is cleaned first, and then a 10 ml syringe with 0.9% NS is attached. Then after that the catheter is flushed with this syringe, and then a vacutainer sleeve or extra vacutainer sleeve or syringe that is there, you have to attach with it. Then push in the extra vacutainer tube or syringe to draw off the waste blood. So after you have flushed, you can use an extra vacutainer sleeve or syringe to draw the extra blood, and that is draw off the waste blood around 3 times the catheter priming volume. Okay, 3 times or 2 times you can use. Like suppose you have pushed 10 ml, you have to withdraw 20 ml or 30 ml blood and discard this waste blood. Then obtain the lab samples in a fresh syringe or vacutainer, and then again flush the catheter with normal saline and place a sterile end cap. So this is the discard method. One problem with this discard method is that in ICU patients we have to routinely send the blood cultures or the CBC, LFT, routine investigations which are there, CBC, LFT, RFT, every day. So what will happen if we use the discard method? So every time we are taking samples, we have to discard some 20 ml or 30 ml of blood. So this can cause anemia in the patient and the HB levels may fall. So instead of this discard method, you can use another method, that is the push-pull method. Okay, in push-pull method what happens, the catheter is flushed and use the same syringe pull to aspirate 6 ml of blood into the syringe. Then keep the syringe attached to the catheter hub, push to re-infuse the blood into the catheter. So you have to aspirate, first you have to flush the catheter, then you have to aspirate 6 ml of blood, Then you again have to reinfuse. Like this you have to do it 3 times, okay, at least 3 to 4 times if you do aspiration and reinfusion, and then discard that used syringe and attach a new syringe and draw the blood sample. And after drawing the sample, you should flush it with 10 to 20 ml NS and apply a sterile end cap to the hub. So in this case you don't have to discard any blood, and the patient will be prevented from any kind of hemoglobin drop or anemia. Okay, so push-pull method is better as compared to the discard method. So these are the two methods, discard method and push-pull method, that is used. This references I have taken from Lippincott. So these are the methods which are mentioned there. So any method can be used based upon your hospital protocol. Then coming to the removal of central line catheter. So after the central line purpose is over, if the patient is off from vasopressors, inotropes, no blood transfusion is needed, no TPN is needed, no means less antibiotics, the patient is on less number of antibiotics, then or any anti-carcinogenic agents, means chemotherapeutic drugs are not going on. So in those cases you can remove the central line catheter. Okay, so suppose it is a tunnel catheter or non-tunnel catheter based upon its use. So tunnel catheter we can't keep for more number of days. Sorry, the non-tunnel catheter we can't keep for more number of days because there are high chances of infection. Whereas non-tunnel, the tunnel catheters which are there, or implantation ports, so these are present for a longer duration because of hemodialysis or because of chemotherapeutic agents the patient is on, so it can be kept for many days. But the non-tunnel catheters, it has to be removed once the patient is out of the ICU. So before removing the central line, so what is the procedure of removal? You can't simply go and pull off the central line like that. So there is a procedure. So before removing the central line, make the patient supine. Okay, remove the old dressing with the clean gloves. So first you have to make the patient supine. What is the reason why the patient is made supine? Because if you are trying to remove the central line while the patient is on a sitting position or a Fowler position, what will happen? There are high chances that air can move into the site, that insertion site which is there. So always place the patient in a supine position, then remove the old dressing after wearing the clean gloves. Then wear a sterile gloves, cleanse the site with chlorhexidine solution or 70% alcohol. Then cut the sutures attached to the skin using blade to remove the central line. Okay, the sutures should be cut, and after that ask the patient to do the Valsalva maneuver. Okay, Valsalva maneuver means there is an increased intrathoracic pressure, so which will prevent the air entry into the insertion site. So when you ask the patient to do the Valsalva maneuver means, or the end of at the end of inspiration, when the pressure is high enough in the lungs, so at that time, or the intrathoracic pressure is high, at that time only you need to gently pull the central line by putting a gauge piece on the side. And also before asking the patient to do the Valsalva maneuver, you should know whether any cardiac history is present or not, because it can cause decreased venous return to the heart. So either you can tell the patient to do the Valsalva maneuver, or at the end of inspiration you can gently pull off the central line by putting a gauge piece on the side. Then inspect the tip of the catheter. So the tip of the catheter should be seen whether there is any breakage or anything is there. So, and after removal, to ensure that the tip is not broken. Then put pressure with gauge piece till hemostasis is achieved. After hemostasis is achieved, then cover the site with sterile occlusive dressing till 72 hours to prevent the risk of air embolism. Okay, so you have to cover the site with the dressing, and after that so that the air embolism can be prevented. So this is the whole procedure of removing the central line. Okay, so I hope you understood about the different central line means about the central line care, how to do and how to remove the central line catheter. So these are some of the research papers which are there in the website about the securement of CVC line. So there are different techniques for securing the CVC line. Like there are like PT fixation method is there. You can go and check it out. And another method is fixation of short-term central venous catheter. So you can see there are two techniques. Okay, one is the insertion site is there. This is the securement device, and this is the wings which are already present in the central line device. So suturing is done in the securement device and also in this wing part. Whereas this is another method. This is called as wing fixation method, and this is the shoelace fixation method. So here you see the suturing is done at the insertion part, then from here the suture is taken and then it is secured to the skin in this securement device, and after that again suturing is done in this winged part as well. So in this paper it was it was concluded that this type of method, shoelace fixation method, is better as compared to the winged fixation method, because here less chances of dislodgement is there. So this is better as compared to this. So if you want to read the paper in detail, you can go to the site and read it. And this previous one is PT fixation. This is another method that is used. So based upon the hospital protocol, the fixation methods can be different from each hospital, from in different ICUs. So if you are interested, you can go and read it, and in the references also you will get so many other um, research papers related to this. So coming to the summary, so this is the last part of the central line care series. So what all things we have read? So first we have seen in the first part about the definition, then the uses, and that is the indication, contraindication, types of CVC, site of catheter insertion, then technique of insertion, formula for insertion depth and position of CVC, then size of CVC, devices which are not considered as CVC, then complications of CVC. We have discussed all this in the first part. Okay, till complications we have seen. And in the second part, we saw what are the procedure of CVC dressing, then what are the flushing techniques, what are the techniques for blood sample collection, and what is the technique for removal of CVC catheter. Along with that, the resources for securing research papers for securing the CVC catheters also. If you are interested, you can go and check it out. So this was overall about the central line care. So if you do like this video, please like this channel and hit the subscribe button, and also press the bell icon for quick notifications. So I hope you understood. If you do have any doubts, please feel free to ask in the comment section below. I will be happy to answer all your doubts. So have a good day, and thank you.